In conventional medicine, you head to the doctor when you're sick. You talk to the doctor sometimes for mere minutes, and you walk away with a medication. But in integrative medicine, your overall health plan has a larger scope. Dr. David Cannon tells us more.
Integrative medicine is a healing-based treatment that looks at the whole patient, the mind, body, and the spirit as well. And it emphasizes the doctor-patient relationship more maybe than conventional medicine. It's more of a partnership than a dictatorship. And it looks at alternative opportunities in addition to conventional medicine and trying to find the best blend of treatments for the individual patient.
And I just love the idea of this because it's all about who the patient is, and it's not 2 minutes and you're in, you're out. It's really getting to know them in all kinds of ways, isn't it?
Yes, it really is. I think that's one of the big differences. It really does take more time to explore all those different dimensions, and they're all important. And so it really does take at least 30 minutes to an hour with a new patient, which is very different than the conventional practice that we now do.
And I know with me, it's so true that there's a million things that I want to tell my doctor, and then I forget about them once I get in the door. And those little aspects can be important in a diagnosis, can it?
Oh, absolutely. And that's one of the difficulties with our conventional practice. We have so little time to spend with a patient, so we have to make a quick snap decision and institute a treatment, whereas this way we really have more time to explore not only to find out what's wrong, but also to help the person find things that they could do on their own to help their own conditions.
And there's so much obesity right now and so many health issues out there. But you guys really focus on doing these things in an all-natural way and teaching the patient to live different.
That's really the crux of it, I think. Rather than prescribing a drug or a pill, what about changing lifestyle? What about your nutrition? What about your activity level, your exercise patterns? And those things that are actually done in a more thorough way can make a better outcome for the patient with less side effects too.
And I would think that this is nice in the thought too that, you were somebody that I can grow old with. I can come to you and discuss new things, and you would know me and my issues throughout my life.
Yeah, and again, that goes back to the importance of the relationship there. And it's a partnership. It's not just coming in and being told what to do. It's exploring together, what are the things that fit in your lifestyle and your routine and your home life, for instance, and what things can you do? A lot of times we, prescribe medicines or things to people that don't fit. They're too busy, they don't have time. So it's finding something that fits with that individual person.
Tell me a little bit about the training process of integrative medicine.
Well, I trained at the University of Arizona, which is a fellowship program. It's 2 years. It was founded by Dr. Andrew Weil, that many people have heard of. And we go through nutrition, lifestyle changes, also alternative healing practices like Chinese medicine, Ayurvedic healing. So we have herbal supplements and sort of off the beaten path forms of treatment that people can use in their own lives.
But some of those off the beaten types of treatment are what has treated people for years and years and years before all of this medicine came out, right?
Exactly. And acupuncture is a good example. That's more mainstream now, but 15 or 20 years ago, most physicians thought, well, don't consider that, it doesn't work. It's been around for 3,000 years, and nothing would survive 3,000 years that's not working and effective. So, and I think integrative medicine is learning how patients can utilize that, which problems benefit from that, and which patients might consider that as part of their treatment program.
And tell me a little bit about Medical Associates itself.
Well, we're a large primary care internal medicine practice. We have some specialty, infectious disease and endocrinology as well, but we're basically a primary care practice for the community.
Of Central Virginia is located at 2215 Landover Place in Lynchburg, 434-544-2317, or you can check them out online, centralvamd.com.